But the rationale for designing that bispecific was not based on it inhibiting angiogenesis. In fact, you could argue it would be the opposite. What do I mean by that? If you inhibit angiogenesis, if you interrupt blood flow and blood volume, if you cause hypoxia as a result of doing that, would that make other drugs that you're trying to administer at the same time less effective?
Mm-hmm.
And so, you know,
And more drug resistant.
in the early days of anti-angiogenic drugs, there was a lot of skepticism about the concept of anti-angiogenesis. The feeling was anything that makes tumors more hypoxic will make tumors more aggressive and less sensitive to other therapies. Now, for reasons that I still don't understand completely, that didn't turn out to be the case. The major way of giving anti-angiogenic drugs, at least when you're using antibodies, is to combine it with chemotherapy, or now, immunotherapy. So I think the feeling is that the bispecific works for the following reasons. It's mainly allowing the immunotherapy part of the antibody to work more effectively. And there are two theories behind that. Okay, number one, again, for reasons that are not entirely clear, it's been published that the affinity of the bispecific antibody for VEGF is increased by the PD-1 targeting part.
Mm-hmm.
And the reverse is true. So it makes the antibody more potent. Number two, when you look at a patient or a mouse that's expressing PD-1, where are you going to find most of that? Well, you're going to find it mostly in T cells that are activated and are in a tumor mass, okay? So what happens is that the VEGF part of the tetravalent antibody is kind of dragged down.
Yeah, we're not bringing
And that's important because VEGF inhibition has a lot of side effects. Hypertension, clotting, bleeding, and proteinuria are the major class effects. So the theory is, I don't know whether the evidence for it is really that good yet, but the theory is you'll get more of the VEGF targeting part sequestered into the tumor mass less systemically. It'll make the drug less toxic while at the same time making it more effective. We'll see.